My name's Harun Durudogan, and I'm an orthopedic surgeon at Southwest Orthopedics. As a general orthopedic surgeon, I am dealing with numerous musculoskeletal problems, mainly knee and then probably shoulder, hip, ankle. Most of the time we're dealing with different fractures that we get from trauma cases, or we're dealing with degenerative conditions that require replacement. The motion is life is my expression that I always feel that is just the most important aspect of what we're trying to get at. We like issues related to pain relief, but our patients really want function. They really want to be able to do these various motions to help them be more functional with their activities of daily living. We've been using Dynasplint since about 2003, and Dynasplint has really helped us, especially over the past 3 years, as being more integrated with our post-op protocols for our various patients. When it comes to functional range of motion for the knee, some people say, you know, anything past 90 is great, and they all get focused on flexion. I really feel that extension is paramount, that if you have a straight knee, that you're going to walk without a limp. Anyone with a bent knee is going to limp, and I think that the extension is really important, that Dynasplint can help us. But first and foremost, I concentrate on getting that person to at least 0 degrees of full extension. As far as flexion goes, I think it's more than 90. I think today people are much more active. I think you really need about 110 degrees to be able to do functional activities, getting into and out of bed, into and out of the car. Certain stair climbing situations really demand more flexion, and so I'd say anything past 110 is good, and we like to have 100 and 125 would be ideal. I think that the person's response to the injury and how they form scar tissue really affects their outcome, and that in typical situations after surgery it takes about 2 weeks for the scar tissue to really start forming. And if they have not been diligent within those first 2 weeks, you're really behind the 8 ball to try to overcome the formation of scar tissue. And that's where I think that Dynasplint comes into play to really help them get off on the right foot. I'm always telling patients they're 168 hours in a week, and going to therapy for 2 or 3 or 4 hours is not what's going to ensure their success. Dynasplint is something that they can work on their own. They are their own best therapists, and I really feel strongly that you have to put the effort into it. I'll tell patients that it's 1/3 of what I do as a surgeon, but it's really 1/3 of what they do to be motivated, and that last third, whether it's Dynasplint in conjunction with therapy, I think that it is paramount to help them get a good grade in terms of their return to function. It makes a difference. That we see patients that really struggle with therapy, even after manipulation under anesthesia, that we've done everything that we can do on our end, that the patients who have had the benefit of the use of the Dynasplint, they do better.